Let's continue to help to contain the spread of this virus in our individual spaces. Moving on, with the increasing number of coronavirus cases recorded in the United States of America, the World Health Organization has declared America the new epicenter of the global pandemic. Just like in other countries, most cities in America are on lockdown, with medical personnel on the front line almost overwhelmed. Nigerians living in America contribute a significant number to the medical workforce. I've been speaking to some of them, and they tell me how they are coping. As the 2019 novel coronavirus continues to sweep through countries, governments are in a race against time to implement strategies to protect their citizens. With about 1.5 million confirmed cases in more than 200 countries globally, at least a third of the world's population is now on lockdown. What started 4 months ago in China has relaxed its grip on Wuhan, while reaching alarming peaks at the new epicenter of the coronavirus pandemic, the United States of America.
We're strengthening the stay-at-home advisory by adding recommended curfew for at least the next 3 weeks in Boston.
Most of the 50 states in the U.S. have issued stay-at-home orders, leaving only essential services open to the citizens. Living through a pandemic may be hard, particularly in a country like America, where people often travel long distances between work and home. Chucks is a Nigerian resident in Houston. He says the once buzzing streets of Texas are now empty, with social activities grounded.
We're watching on TV, happening in China, and then on the cruise ship, and in Washington, and then all of a sudden the children were to return back from their spring break, and were told they should stay back home for a month. And then the grocery stores that are running out of basic items like milk, egg, bread. And then soon after, we're advised from work to work from home if we could. And then about 2 weeks ago, the governor issued a directive for restaurants to shut down their in-dining, for gyms and bars to close up. And following that, the malls were closed, and then the churches, then the issue was this directive that there should be no public gathering of more than 10 people in Texas. And so consequently, the religious services were shut down as well, and now it's all an online experience.
With the rising number of cases topping 300,000 and over 8,000 deaths, states have shut down religious centers and hospitals are filling up. According to the Migration Policy Institute, more than 50% of black doctors in the United States are Nigerians. This reality brings the fight to contain this virus closer home than we all imagine. In the US, like Italy, dozens of health workers are falling ill with COVID-19, and more are being quarantined after exposure to the virus. Tunji Adeni is a doctor in West Virginia. He says the battle against the virus could sometimes be overwhelming on the front line.
The reality is very surreal. I mean, many of them are working overtime, many shifts. Last week, we had 21,000 healthcare personnel of different types volunteer and moved to go and help them out in New York. Many of these ERs have been slammed, so to say, or hospitals. Many of them have been filled to the capacity with these patients. So they are still experiencing the surge, so to say. But we are hoping that because the state is on lockdown, all the people that are sick, by the time it runs its course, the curve will flatten, and then we'll start to see it decrease.
Queen, a Nigerian nurse in Maryland, claims she faces a new reality every day.
You're bringing materials, machines that you're seeing for the first time sometimes, and you're trained just like that, and then you have to be quick, on your feet. You can't afford, for there to be any lapse, because the lapse might just lose a life. People are just dying in their hundreds, and it's scary. We have great fears of taking it home because our loved ones are locked down at home, and if anybody comes out sick, that means we took it to them. And so somebody like me, when I get home, I go through the basement. You can't hug your family, you can't hug your children, because You don't even know if you've been infected. You don't know if you're carrying the virus. You don't know if you're a carrier. Do you understand what I'm saying? And so somehow, consciously or unconsciously, you are self-isolatory.
Like Nigeria, the United States has no universal health care plan for its citizens. There have been cases of limited personal protective equipment, ventilators, and respirators to contain the COVID-19 pandemic. Despite stepping up supplies in health facilities, many people are dying. Tunji and Queen want Nigerians to observe simple precautionary measures to prevent the US reality.
Do that. I am afraid for my Nigerian people. So the best way for you to stay safe is stay at home. Don't go visiting. It's not the time to go visiting anybody. If anybody has anything to do, the COVID cannot be transferred, via telephone. So call whosoever you need to call, text them, ask them what they want, and you can communicate via phone. But please, I would just tell them to stay at home because you don't have medical facilities.
We have limited resources. If you get it, we do not have as much resources as we have everywhere else. So prevention is what we should be very strict about. So the social distancing and the isolation and all the stuff that is being said out there, take it very seriously. Wash your hands every time as much as you can. If you know anybody that is sick or that has fever, has respiratory symptoms, figure out a way to get them out of the general population and get them helped.
As the world continues to record a rising number of cases, we all have a role to play to contain the spread of the virus. Stay at home, wash your hands with soap and water while practicing social distancing. Ajoke Hulotse, GIST Nigeria. Do stay safe and continue to observe all precautionary measures. So, has the lockdown been effective in your area, and have you received the government stimulus package? Do share your experience with us at GIST Nigeria TV. We're looking forward to hearing from you. Still ahead on GIST Nigeria from the BBC and Channels TV. It's raining shillings for fishermen in Kenya as residents shun imported fish for local ones. Stay with us.